I'm a founder of Forest Park Medical Center, and the whole driving force for creating Forest Park Medical Center was patient care and more efficiency.
It's a facility that is owned, managed, and run by physicians. And I personally feel that there is no person who is better suited to be able to manage healthcare than a physician.
Forest Park to me represents a real exciting direction in medicine because it really represents being able to build the very best for the very best reasons. So we're building a tremendously state-of-the-art hospital that benefits both the patients and the doctors equally.
In a physician-owned center, you're talking to people who understand medicine. They understand why you need this. And it's not just a dollars and cents thing. You're actually improving patient care because you know what you need in order to take care of the patients.
Well, I think any hospital system for us needs to integrate as its center really the patient. And the patient needs to be the most important piece of the process because obviously they're the ones that are being serviced. And oftentimes in a situation where they really need that service, there's a disease process going on. That hospital system needs to integrate that patient and then also additionally the medical staff as well to allow us not only the room, the time, but also the proficiency in terms of the staff to be able to take care of that patient. And I think Forest Park does that very well.
From the patient's side, they get the very best of comfort, the very best of service, the very best of food, the very best of attention to detail. From the physician's side, since the physicians have a direct relationship to the administration, we get the very best of everything we want.
I love being a part of Forest Park. I feel like what sets Forest Park apart from the other hospitals that I operate at is that they really listen to the doctor's needs. They do everything very efficiently. They've got a great crew and team that's dedicated just to doing surgery and making sure that every surgeon has their needs met, and they offer and deliver really good patient care to my patients, which is just as vitally important.
The beauty of working at Forest Park is that the patient's need comes first. So much of medicine nowadays has taken the patient first mentality out of the mainstream. With Forest Park, everything that has to do with the patient comes first.
Many times other doctors will ask me, why do I like coming to the Forest Park system? And I work at both Forest Park Dallas and also Forest Park Frisco. And in fact, recently a surgeon in another facility said, why do you go there? I've heard it's more expensive there, et cetera. And I say, well, first of all, the patients love it because it's a beautiful facility. And it's like the Nordstroms, Neiman Marcus of hospitals. But that's not the reason I really like it. I'm glad it's nice and clean and it's lovely to be there. But the real reason is the hospital is focused on making the physician efficient, and also the hospital is really, really working for the doctor.
I will just say this, I enjoy being part of the Forest Park system because it's physician controlled. My analogy to this is the best restaurants in America are run by chefs. And so my feeling is the best hospitals in America should be run by physicians.
I think the healthcare industry is changing as a whole. I think the days are coming that you either will be owned by a hospital or you can own a hospital. The choice is yours. You can make a decision to be involved in your own future, control your own future, control the equipment you have in a hospital, control the turnover time after your cases, and that's the opportunity that's present with Forest Park. You can have a hospital that's owned and managed and operated by physicians, for physicians, or you can be an employee at another hospital where an executive with an MBA can tell you what to do, when to do it, and how to do it. I'd rather be in charge of my patient's care rather than somebody else telling me how to take care of them. So I think there's a clear choice, and you can make a choice to be a part of this or be an employee. And I certainly did not go through all the schooling to be an employee. I went to school to be able to take care of my patients in a manner that I deemed appropriate.
No one cares more about their patients than the doctors, except for maybe Forest Park.
I think that this will be a wave of the future. Eventually, I think this is how all medicine will be practiced.
Forest Park, to me, is an exciting direction in medicine, representing the best of the best.